My name is Brent. I'm going to be your student nurse today. Today we are going to insert your NG tube, which is going to run from your nose to your stomach, provide you and remove contents that you may or may not need. First thing I want to do is provide you some privacy, and I want to wash my hands. Can you state your name for me, please, sir? Alright, good deal. Alright, Miss Patient, we'll get you taken care of. Going to prepare all of my equipment. First thing I'm going to do is I'm going to set this here. Set your linen saver on top of you just in case we make a mess. The basin and a cup of water, which we'll use here in just a minute. Going to tear off a few pieces of tape. We got temporary tape. We've got tape for marking, tape for your gown, and tape for your permanent or temporarily permanent on your face. Go ahead and don gloves. I want to check to see which one of your nares is going to be easiest for us to do. So if I can get you to inhale and inhale for me. Alright, the right nasal is, right nare is more pregnant. And next thing we want to do is check the length of our tube real quick. So we slide this down. We're going to measure from the nare to the ear and from the ear to the xiphoid process. Put that back up here, slide that back. We're going to mark with our tape.
Good morning, my name is Christy. I'm here to fix your NG tube, Dr. Doyers.
Next thing we're going to do is add a syringe. And then we're going to lubricate the tip of the tube. Alright. So I need to raise the bed and raise you into high Fowler, which is almost 90 degrees, and raise this to a working height. Now that we got you here, we are going to insert this into your right nare, and then it's going, once we get to the back, we're going to get you to tilt your head forward. So first off, if I get you to tilt your head back for me, we're going to slide this in nice and gently. And now that we're at the back of the throat, we're going to get you to tilt your head forward and swallow. And if you take a sip of water every time you need it, and every time you swallow, we're going to push down, and we're going to go into your stomach. So swallow, 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 swallow. Alright. Now that we got you down into where we need it to be, we're going to place this here temporarily. And we're going to check to make sure we have the tube properly placed. So can you speak for me? Doing alright? Okay, good. Also want to check into the oral cavity to make sure it's not coiled, which it's not, it's clear. Alright, so we're going to slide this out the way. We're also going to draw some gastric juice. And 5 to 10 milliliters should be plenty. Clamp that off and check the pH strip. pH is 0 to 4, so that's normal level. If anything higher than that, it'd be depending on the patient's, if they'd eaten or not within the last few hours. Gastric juice is also the correct color, so we're good there. Add that to that. Add that to that. Good there. Alright. So now we are going to permanently take this. Going to add our VID00003 into the nose. And we're going to remove that. We got your tape there. And then we're going to affix this into your gown. Cool. Done here. Got that there. And then I'm going to return you to your floor and in a comfortable 30-degree bed height position, elevation. After that, I would take my gloves off, wash my hands, go ahead and make sure we have an order for an x-ray to ensure that we do have the NG tube placed properly. Yeah. I document also that I placed in the tube into the right nair. We got it on the first try. The gastric content was correct, pH was fine, color was good, and the patient is compliant and doing okay considering the circumstances. Alright. So to come in, we're going to do the removal now. I come in, provide privacy, wash my hands, I check my patient. Can you state your name for me? Alright, good, Miss Patient. Alright, I am going to be removing your NG tube. I will be instructing you through it all the way, and it should be a lot easier than it would with us putting it in. So I'm going to raise the bed up and up to a working height. I'm going to have my disposal bag here, and this is going to be my tissue. So what we're going to do is we're going to remove this from here and remove this from here, and in my non-dominant hand I'm going to hold my tissue under the nose, and I'm going to instruct the patient to take a deep breath and hold his breath. Alright, so hold your breath. One long quick, good. We got that all wrapped up. That's going into trash. Set that here. I'm going to give my patient a warm washcloth to provide hygiene for themselves, just because of the uncomfortability. I'm going to ask the patient to speak to make sure he's okay and he's compliant. So we're good there. I am going to return the bed back to a relaxed position and to the lowest position closest to the floor. I'm going to remove my gloves. Form hand hand hygiene, and I'm going to document that we got the tube removed on the first try, no issues, no complications, and the patient is ready for whatever comes next.